Okay, here are top 3 rosacea triggers and how you can avoid them. So first and foremost, what is rosacea? It's a chronic inflammatory skin condition, actually similar to acne. So a lot of people who get acne when they're younger actually tend to develop rosacea when they're older. And that's because acne is all down to oils, sebum production. When you have oils and sebum in your skin, that causes inflammation. That inflammation is lots of tiny little blood vessels forming in your skin. When you have lots of blood vessels in the surface of your skin, that can cause sensitivity, inflamed skin, and hence over time, rosacea. It starts off as a bit of fragility, a bit of thread veins, then becomes a little bit more flushed in the cheeks, around the nose, and then as you get older, it becomes more severe and more severe, and then you get thickened nose, you can get pustular rosacea, you can get a globally red erythematous. Actually, here's a before and after of one of my patients in 3-month time span. How do we get from this to this cleverly? Okay, first, so what are the triggers? So because it's lots of little blood vessels, key triggers are things that vasodilate your blood vessels, so things that thin your blood vessels, i.e. heat. So really hot showers, spicy food, direct sun exposure, all those things make your blood vessels open up and therefore you look more flushed and more red than you did when you woke up probably. Other thing is alcohol. Alcohol vasodilates your blood vessels. That's why I always tell you to avoid alcohol when you get any cosmetic treatment because it will thin your blood and increase risk of bruising. Same thing goes for rosacea. It thins your blood vessels and you look more red. And that's why people think it's because of alcohol, but it's not. It's just that alcohol flares it. And then the other thing is harsh skincare. So you probably find if you're trying to introduce an acid or a retinol, you're so sensitive to it. And that is because all these little blood vessels are sitting there and they don't want to be irritated. So what do you use? You use my favorite ingredient, azelaic acid. It calms inflammation. It's also anti-acne and it will just stop all those alarm bells on your skin and it will lighten your complexion as I showed in that before and after photo. Win-win every time, but trust the process. Be patient, use it every day, morning and night if you can, for at least 6 weeks before you start seeing results. Remember, your cell turnover takes about 28 days minimum to go through a cycle. If you have any more questions about rosacea, let me know in the comments.